Our company is part of a larger company called Kinetic Care Group. We have 7 clinics between California and Colorado. We employ about a dozen physical therapists and a dozen assistants, see on average 5,000 visits a month. When we're looking at the bottom line and we're looking at the work we're doing, what it's costing us to produce that work, we need to make sure that we can optimize our reimbursement the best way we can. And the best way and safest way, in my opinion, is to do it compliantly. And with Prompt working together with PredictionHealth, I think that marriage has kind of come together for us. So we can use the data that we are generating in Prompt being analyzed by PredictionHealth and compliantly increasing our reimbursement as much as possible. Within the last couple of weeks, we're in a conversation with Cigna. Our pitch was data from PredictionHealth out of Prompt that made that case for us. We're able to go and say, hey, we are providers who are compliant. We can produce this data. This is how many visits we see per ICD-9 code, all based out of data coming from Prompt, analyzed by PredictionHealth that we can pull out today. And that's very helpful for us. Prior to using PredictionHealth, our compliance program revolved around reviewing 3 charts per therapist per year. So we had a very small view of what was going on in the practice. Since we started using PredictionHealth, obviously now we have visibility on every single chart for every provider. So we try to diversify our codes so that we can obviously put them in the right category for what for the services that we're providing. So a couple of things that PredictionHealth does for us, it actually can look at codes and make sure that we're billing the code consistent with what the CPT definition is. And then that helps us diversify our codes. But what we also can do is we can look at a visit in terms of time and in terms of units that are charged. And we can see and analyze if we're spending too much time in relationship to what we're coding and what we're billing. Is there an opportunity to pick up an extra code, for example? PredictionHealth is very good at analyzing time to code, which ultimately translates to reimbursement for us. So there's a number of pickups that we found where we're just spending more time than we're billing. And that becomes an education process for our providers. And again, you can measure that by provider over time, which is really helpful.